Hi everyone, I am Dr. Ajayan Payyadakkath, working as a specialist pediatrician in NMC Royal Medical Center, Samnan, Sharjah. I am having more than 15 years of experience in the field of pediatrics. My area of interest is growth and development, infections like respiratory tract infection, gastrointestinal infection, immunization, urinary infection, growth and development. Today we are talking about the most common bacterial infection in children, especially less than 5 years of age, urinary tract infection. So what is UTI? So urinary tract infection, that otherwise UTI. So it is the bacterial infection affecting the urinary tract. Urinary tract consists of kidney and the connecting pipe between the kidney and the urinary bladder called ureter, and the urinary bladder and the urethra. So infection affecting any of this part is causing urinary infection. For the symptoms and the treatment purpose, we can divide into upper urinary tract infection and lower urinary tract infection. So what are the parts of upper urinary tract? It is kidney and ureter. Lower urinary tract is urinary bladder and urethra. Urinary tract infection is important in children because if there is a delay in diagnosis and thereafter treatment, it will affect the developing kidney and causing long-term complications like scarring of the kidney, hypertension and renal failure. So detection at the early itself important, so that we can give adequate treatment to avoid the above mentioned complication. The risk factors of urinary tract infection are: first and foremost is dehydration, means not taking adequate water. Second is constipation, it's very common in the children. Third is any anomalies of the urinary tract from the kidney, ureter, urinary bladder or urethra. If any of the risk factor is there, so we have to be vigilant while treating the patient. Less than 1 year, urinary tract infection is equal in boys and girls. There is no gender difference. But after 1 year, females get more urinary tract infection because of the short urethra, and there is chance of more fecal contamination. So females are more prone for urinary tract infection after 1 year of age. The symptoms of UTI is depending upon whether it is urinary tract infection, upper urinary tract infection or lower urinary tract infection. In the upper urinary tract infection, we may get high-grade fever, flank pain, means in the side of the tummy, we get over the center of the tummy, abdominal pain. There will be shivering along with the fever. There will be vomiting. There will be diarrhea. The symptoms of lower urinary tract infection consist of frequency of urine, burning micturition, means the pain while passing urine, and foul-smelling urine, and change in the color of the urine. Diagnosis of UTI is very important. Commonly, we will do the routine urine examination that consists of the pH, the pus cells, RBCs, crystals and bacteria, and some enzymes like glucose esterase and nitrate. These are the screening tests, but the specific test to diagnose urinary tract infection is urine culture. So once the urine is collected, we have to process within 30 minutes to 1 hour. Otherwise, it will get contaminated and it will affect the diagnosis and treatment. Treatment of UTI depends upon whether it's upper urinary tract infection or lower urinary tract infection. Means it is a simple UTI or complicated UTI. Simple UTI means there will be mild fever, the child is otherwise okay, oral intake is good, hydration is good. So after collecting the urine sample for the urine routine and the culture, we will start the oral antibiotic. We will wait for 48 hours for any improvement in the symptoms and the condition of the child. If the child is clinically improving, once the urinary culture report is ready, depending upon the sensitivity pattern, we will continue the antibiotic, the same antibiotic. If any change in the antibiotic, we will change the antibiotic, and the duration of treatment is around 7 to 10 days. And for the complicated UTI, means the child is less than 1 year of age, the child is having high-grade fever, child is not taking anything orally, there is chance of dehydration. So we will admit the patient. We will start on intravenous, means injectable antibiotic after taking the urine for urine routine and culture test. If child is symptomatically improving and the culture is normal, we will continue the same antibiotic for 48 hours. If symptomatically improvement is confirmed, either we can continue the IV antibiotic or we can change to oral antibiotic, and the duration of the treatment is 10 to 14 days. Complicated UTI, that means it is affecting the kidney and ureter, and the child is less than 3 months, child is not accepting oral fluids. We have to admit the patient because hydration is more important in the treatment of the urinary tract infection along with the antibiotic. As you know, prevention is better than cure. So first and foremost is the genital hygiene and adequate hydration. Avoid the postponement of the voiding. Means ask them to urinate whenever there is a need. Don't postpone. Whenever going to school, ask them to take adequate water in frequent intervals. Increase the intake of fruits and vegetables and avoid constipation. Means the constipation will cause urinary infection. So the parents will ask how constipation will cause urinary infection. When there is a constipation, this fecal matter will compress the urinary bladder. As I told, the lower urinary tract, the urinary bladder. So the urine will be collected for a long time. So the stasis urine will give a chance for the bacteria to grow and leads to the urinary tract infection. If the child is less than 1 year, after the antibiotic treatment, we will do a ultrasound scan of the abdomen to look for the kidney, ureter, urinary bladder and urethra. If ultrasound is normal, after 4 to 6 months of the antibiotic treatment, we will do a DMSA scan to look for the function of the kidney and structure of the kidney. And thereafter we will do MCU, micturating cystourethropography, to look for any reflux or the urinary tract is normal. 1 to 5 years, if the ultrasound abdomen is normal, after 4 to 6 months, we will go for the previously mentioned DMSA or DTPS scan. If DMSA scan is normal, no need of MCU. More than 5 years, we will just do the ultrasound scan. If ultrasound is normal, no need of any MCU or other further investigations. The take-home message is urinary tract infection is most common in younger children next to pneumonia. As you know, summer is coming, chance of dehydration is common. So, detection of the urinary tract infection and adequate treatment and appropriate treatment for the appropriate duration is important. As I mentioned at the beginning, if there is a delay in the diagnosis and adequate treatment, it will cause long-term complication of the developing kidney, leads to hypertension, scarring, renal failure, followed by there will be need for hemodialysis. So diagnosis in the beginning and treat appropriately with adequate antibiotic with a trained pediatrician. So for the prevention, hydration more important and avoid the sugary drinks, junk foods, chocolates, chips, and increase the intake of fruits and vegetables, juices to prevent dehydration. I believe I have covered most of the questions of the parents. If you want to know further about urinary tract infection or anything about your children, I am Dr. Ajayan, working as a specialist pediatrician in NMC Royal Medical Center, Samnan, Sharjah.